Today I'm here with Rachel and Wally. They are a monogamous married couple, and you guys have been together you've been together for the long haul so far, like 11 years, right?
Yeah.
13 years as friends.
Yes.
I'm like pretty impressed. Pretty impressed with you guys.
We're pretty impressive.
You're kind of impressive. And we're here today to talk about what happens after you have a baby, because a lot of things change. And also, the subjects of postpartum and sex when you're experiencing postpartum.
Yes.
Yeah, so talk to me about that. How old is your child?
She's 2.5 now.
She's 2.5?
Yeah.
Okay, so this is still also pretty like recent stuff.
Yes, yeah.
Still fresh in our minds.
Yes. I'd say things only, to give a timeline to the whole thing, things have only gotten back to where they were before just recently. So
okay.
And that road is different, I know, for a lot of different women.
Sure.
So I gave birth vaginally.
Okay.
And pregnancy is a lot of things.
Oh my God. I would not know. You can tell me about it. I would not know. Yeah.
It's a lot of hormones, and there are so many different changes, and it's hard to pack them all into this tiny little sound bite. But
Sure.
You go from having all those hormonal things happen to the physical changes to passing a child through your vagina.
Yeah.
I had minor tearing, so I did require stitches.
Right.
And then all of that, and then how do you continue to have your relationship?
Your whole life has been like thrown up in the air. You're a parent now. Yeah.
Yeah. And I mean, we've always been really sexual.
Okay.
Awesome.
2 thumbs up on that one. Yeah.
I will say that we were having, we have sex at least once a day before things started. I won the pregnancy.
I'm super impressed with you guys now. This is great. Yeah.
Once pregnancy.
Before the baby.
Before the baby.
Yeah.
Pre-baby.
Pre-baby, post-baby. Yeah.
I won the lottery a little bit with my pregnancy. Hormonal changes can cause a lot of different side effects.
Right.
I went through puberty again, so 4 orgasms a day was not enough. And we were having sex.
So you were ramped up.
Oh yeah, it was insane.
Okay.
I was literally insatiable for
Wally,
most of
were
my
you
second
I was not
trimester.
keeping up. I was
You were like, holy shit. I was like, fuck, what's going on? Okay, so that was a little hard for you.
I mean, I wasn't complaining.
No. Yeah. But still, it's
I only
like,
do so much.
Yeah.
it's a lot. Okay,
Yeah, it's
so
a
you
lot.
were raring to go.
Yes,
Yeah.
all the time.
Yeah.
And then pregnancy happens.
Right.
And then you're supposed to wait at least 6 weeks.
Sure.
So then you have to get over this hurdle of.
Can I just ask,
Yeah.
did you feel quite a quick change in your libido from when you were pregnant to after the birth of your child? Was it boom, and then all of a sudden things were different, or did you still feel horny and you were kind of annoyed you had to wait for 6 weeks? What was going on for you?
I'd say probably for the first year, I felt pretty asexual. There wasn't much thought.
You just didn't have a drive.
Yeah, I just didn't have a drive. And then I tried to go to the things that would get me going in the past. So I'd read smut or I'd watch some porn.
Right.
And nothing.
Nothing would go on.
No lady boner at all.
So this happened pretty literally the line of birth literally went from wanting sex 4 times a day to not even
Nothing.
enjoying yourself when you're watching porn.
Nothing.
Oh wow.
Yeah. So it was pretty dramatic.
Yeah.
And then
I would say so.
And so the 6 week marker came, and I know this is it's different for everybody, but
Sure.
those hormones are all over the place. You're sleep deprived.
Oh my God.
I was breastfeeding, so there's a lot
Oh, wow.
of sensory overload because there's
Yeah.
something on you all the time, and
I've heard
Yeah, I
about
didn't want to
nipple chafing and bleeding and
a little bit of that in the
with all the
beginning.
latching and stuff.
Yeah. Figuring it out. Babies don't come out being the most amazing breastfeeders. That's
They
just
don't.
not-
They have to learn. They
have to
don't
learn.
know. Yeah.
And then you have to learn, and
Yeah.
so yeah, you're your sensory, you're
Yeah.
just overloaded.
Don't touch.
But then
Yeah,
like,
yeah.
Sit with me on the couch, but
Yeah.
space.
Yeah.
but you know, like, so then we get to a place like where, I will say the one thing that I always recommend to everybody is just being really good at communicating.
Yeah.
And like, we are really open with each other, and we're very communicative about what we're feeling, what our
That's
sexual
why you're
needs
probably
are.
still together. That's
Um.
probably why they're still together. Yeah, but I mean, I don't think everybody's skill level on that is at the same place, you know. So you guys didn't end up needing to do any couples therapy or anything, right?
No, we
Yeah.
were pretty comfortable.
Yeah.
And
Talking about whatever it is that we
Yeah.
needed, wanted, missed, wanted to stop, whatever it was.
Right.
And then getting over that first hurdle of putting something inside my vagina again.
Right. So that must have been, was that literally physically shocking or?
Yes.
Yeah.
Yes. It hurt. So that took, there was a lot of trial and error because we wanted to like do certain things, but then
And then
we
you're like,
try it
"Ooh,
and no,
back it up,
this
back it
is,
up." Yeah.
not working, and then figuring out positions or, we didn't always, have vaginal intercourse either. Like
Sure.
we really mixed it up
Which-
to try to make sure we were
because-
just.
Because I was just about to say, like, penis and vagina is not the only kind
Right.
of sex you have to have. Guys. There's a lot of other stuff to do. Doesn't have to be P&D.
So yeah, it was an opportunity to explore too.
Yeah.
So mix it up, do different things,
Yeah.
and still like maintain our intimacy.
Right.
Um,
How did you maintain intimacy when the sex just wasn't happening for you? Was it cuddling? Was it like just enjoying time together?
Say more time together.
Yeah,
Yeah.
time together, and then
It's like I was saying, you didn't want physical contact a lot of times after
Mhm.
like a whole day of walking around with her, feeding her.
Yeah.
boobs out, just hot mess. Yeah, yeah.
My God. And so you feel like you just said at the top of the interview, things have kind of just come back around to
Yeah.
sort of, the equilibrium's come back a little bit.
Yes. Our
So-
child sleeps. We're
their child sleeps.
Yeah, we're able to get more sleep, and like our, my libido's returned.
Awesome.
So
I kind of want to high five you. High five you too. They're kind of great.
And I will say, just like as a small thing too, that like the things that turned me on prior to birth are not the same things that really turned me on
Really?
now. Yeah, and which
Oh.
I've heard is quite a common thing, that different things.
Everything
yeah,
shifts.
Everything changes.
Your whole body, your whole mentality shifts.
Yeah.
Yeah, that doesn't surprise me in the slightest. Yeah. And how was it for you? I mean, you said like you obviously from this interaction here seemed like you were understanding and patient around it. Was it frustrating for you at points? Like you just wanted your wife back, or what? Like.
I don't know if I just wanted my wife back. I felt like you were still here. I just wanted to kind of relax again and just enjoy that time that we had that now is taken up by
Yeah.
responsibilities.
Sure.
Yeah.
And that's your life now. I
Yeah.
mean,
Yeah.
you have a baby and then you have responsibilities for the rest of your life. Yeah. Like, don't mention that now. We're talking about sex. We're talking about the good stuff. Okay. Parenthood is wonderful. Asterisk. Okay. Oh my God. Thank you so much for talking to me about this. I feel like I tend to talk about all the sexy stuff and all the wild stuff, but this is also really important because our bodies can go through so many changes, not necessarily even something as massive as becoming a parent. And I think we need to be patient with our bodies when they go through these big changes, whether it's parenthood or a sexual trauma or a breakup or a heartache of some other form. Like, we're sensitive to all that, and our sexuality like ebbs and flows a lot with all those events.
And self-love is really important, like taking care of yourself and being generous with yourself as you navigate those things.
And giving yourself time. It seems like you guys gave yourselves a lot of time
Yeah.
to just be patient with it
Yes.
and not rush it.
Yeah.
Awesome. Thank you so much for spending some time with us. I'm sure that there's some more links about, sex and sex, experiencing sex with postpartum depression. We'll put some references at the bottom of this video. Thanks again, everybody. We'll see you next time.